Hello.
Hey, Justin, how are you?
I'm doing great. Thanks again for creating this opportunity.
Problem. It's a little bit later for you in the morning now. We got you up so early the last time.
Yeah, this was easy peasy.
This is a decent hour.
This is the final day of the conference, right?
No, it was last week.
Ah, that's right. So this is just bonus time for folks that are interested.
Yep, I think you got some bonus people, so that's
That's
good.
awesome.
Yeah, good.
Are we ready to go now?
Yep, shoot.
Okay, fantastic. Let me
What I'm going to
get
do
my...
is ask people. Justin, you do your presentation. Will you allow a little bit of time at the end for Q&A, and then we'll have everybody on mute, and then we'll do some Q&A, and then maybe direct questions if we have some one-on-one.
Yeah, absolutely.
Okay, perfect.
It's probably going to be, I think last time we tried putting a 20-minute presentation in a 10-minute time slot. So it'll probably be about 20 minutes and we'll have time for Q&A.
We have an hour, so you can take as much time as you want.
Okay, great. Let me first start sharing my screen. Go into presentation. Okay, so thank you all. This was the presentation for the 2020 Village Conference about GoGo Technologies Inc. And we were very proud to be a sponsor of that conference, which I thought was extremely informative and an incredible amount of information, especially considering that it was done virtually. So kudos to the team behind that. My name is Justin. I'm the co-founder and president of GoGo Technologies Inc., which does business as GoGo Grandparent for our consumers. And I wanted to share a little bit more about how we got started. So this is our Chief Inspiration Officer, also my grandmother, Betty Lou Luce in Torrance, California, using us for the very first time to get back from Coco's Diner. GoGo started because my grandma was having a ton of trouble using Lyft and Uber on her own, and because she was starting to lose her ability to drive long distances and at night. I was living with her for 3 years and working on various projects. Eventually, one night, she kind of looked at me and said, "Could you please make something like this? Because the stuff that you're doing isn't really working out." And she was right. So we being my co-founder David Lung and I, we put together the very first version of GoGo, which was a phone number that she could call to request a ride. It's pretty simple, but the way it worked back then was she would just call the phone number, press 1 to get picked up from her home, call the number again, and press 2 to get picked up where she was dropped off last. And so what was cool about this was that she didn't actually have to kind of, ask permission from anyone to get a trip or speak to her grandson to order her a ride. She was able to do this on her own. And so we made the number for her, and we kind of thought that would be that. Many years later, GoGo has grown. My grandma was part of, and still is, part of multiple social clubs, bridge clubs, and book clubs. She kind of got the word spread to our surprise. And now, almost 5 years later, we've been recognized by AARP. We've managed over 2 million trips. We partner with hundreds of organizations from all around the United States, including some villages. And beyond meals, we've recognized the need to expand into other independent activities of daily living. Beyond transportation, we've recognized the need to expand to other independent activities of daily living, like meals, groceries, and we do also medication management. Um, and so I'm here today to talk to you all a little bit more about our core kind of initial service, which is ride management, how it works, how we make it work for organizations. We also are launching kind of a new vertical within our mobility management department. And then I'm also happy to touch on the work that we do, which is similar, though in a different vein, with meals, groceries, and more. And that more right there is the medication management. So as I mentioned, we started this for grandma. Shortly after she spread the word, we realized that we had a problem on our hands. For one thing, lots of people were using it, and that was awesome. The trouble was, as I just described, the service was really just press 1 to get picked up from your home, press 2 to get picked up, you were dropped off last. And in the off chance, in those early days, we thought it would be the remotest possibility that someone would have trouble with a trip, they could press 0 and it would connect to me or my co-founder, David. I kind of thought that there would be very, very few reasons why people might need to speak to an operator. We had all the bases covered, home and the return trip. Unfortunately, we realized that that was not correct when there was a 3-week stretch in mid-2016 where we were woken up every night for 3 weeks in a row from people that were having troubles on the East Coast. So we were getting 4 a.m., 5 a.m. calls. The solution, or I'm sorry, what we understood the problem to become was not a technological barrier, but it was that transportation network companies like Lyft and Uber are not as well designed for consumers that have mobile impairments, visual impairments, in some cases cognitive impairments, and hand dexterity impairments. And that combination of things as you age, even if you're using a smartphone, will make it harder for you to kind of manage the trip experience. And it might not be a devastating impact for younger folks if the driver shows up in a car that might be too small, or if they get lost and they need to be kind of handholded to the pickup destination. But for an older adult, it's the difference between the service being reliable and a reason why they can continue to live in their homes, and unreliable, in which case it's not really there. It's not really for them. So as people were calling us step by step, we put together what we now call the GoGo Guardian program, which is designed to be people working in combination with technology to spot and detect problems before they occur. And what we've seen is, over the last 5 years, the request fulfillment rate has improved. In the early days in 2016, the request fulfillment rate was around 75%. Not awful, but pretty bad. And the difference between someone being able to use this reliably and not being able to use this reliably. Today, the GoGo Guardian program has come together in a very successful way to push that ride fulfillment rate well over 99%, which makes the service usable. It makes it reliable, but that reliability makes it usable for the context that people are using us today to continue living in their homes independently. So I want to talk a little bit more about this GoGo Guardian program. It's really the power behind the scenes of GoGo. It's 4 major steps: ride requested, driver assigned, trip pickup, and trip completed. And I'm just reading those off the slide here, but each one of these steps is an opportunity for GoGo to run through a series of either technical checks or personnel checks to make sure that the trip is happening successfully. And I'm going to run through an example that I think kind of drives it home. This is Louise. She's 85, and she's calling to get picked up from her hair salon. So this photo is her in front of her home, but she's calling us to get picked up in this example from her hair salon. She's hard of hearing. She uses a walker, and she can't get into big cars, SUVs, Chevy Suburbans, that sort of stuff. She doesn't carry a cell phone, and about 15% of our clients don't. She called us to get to the salon from her landline. So she called us from her home's landline, pressed 1 to get picked up, and was taken to the salon. But now she's calling from the salon's office line to get a trip back. So this is a number that we might not have on file for Louise. So she requests the ride. Immediately, our system is able to do a couple things. The first driver that's assigned, Mark, he drives a Hyundai Tucson, which is a car that Louise can't get into. So we immediately cancel and re-request a new trip. And again, for anyone that missed it, we're requesting from Lyft and Uber. These are Lyft and Uber subcontracted drivers. Our system is a layer on top of that that's making that experience work well for clients that have mobile impairments or visual impairments, such as Luis, who has both. So after Mark is assigned and gets canceled because his car is too big, we get assigned Carol. Carol drives a Nissan Sentra, which is a car that Luis can get into, but we have been assigned Carol before. Like I mentioned, GoGo has managed over 2 million requests all around the United States. So many of the drivers are people that we have worked with before. And we know from experiences with Carol that she previously shared that she has a bad back and she can't pick up any additional luggage, which means that for Luis, who again has that walker, this isn't going to work. So we automatically cancel and re-request. This is just the system comparing our information that we have about these drivers and their vehicles to the needs of this particular client at this particular location. So this is all happening very quickly. The next driver is Mohammed. He's someone that we actually haven't worked with before in this example. And so whenever that happens, the system is going to call him and connect him with one of our team members, in this case, Ivan. Ivan is asking Mohammed a few questions designed to see if Mohammed is easy to communicate with and to determine if he's going to be comfortable loading Luis's walker into his vehicle. We can't ask drivers, a quick aside here, we can't ask drivers to physically load, passengers into vehicles, but we can ask them to load that ambulatory equipment. So we're just, and Luis knows that and is comfortable transferring herself into this car. So we're asking Mohammed if he's going to be comfortable loading Luis's walker into the vehicle. Mohammed says that he is. He tells Ivan that he is. Ivan will update our profile of Mohammed for future trips going forward and is going to monitor this trip as, and there's a typo here, but as Mohammed approaches Luis. So now we're moving into the next step. Actually, first, let's recap the first step. Again, this was ride requested. This is the first step of our GoGo Guardian program. So I walked you all through what our system did. From Luis's experience, this whole process took between 30 and 60 seconds, all while she was actually on the phone from the salon calling in. She requested the ride. We screened 2 drivers, contacted a third, and finally, when we approved Mohammed, we read to Luis his name, the color of the vehicle, the make and model of his vehicle, and the last 3 digits of his license plate. And finally, how many minutes it is until he's going to be there. Once she gets that information, she hangs up, and we move into the next part of the GoGo Guardian program, the actual monitoring of the pickup. So immediately there's some trouble. Construction on the highway has slowed Mohammed down, and he falls way behind the schedule, the ETA that we had told Luis. As most of the people here know, that can cause panic if people aren't showing up on time. And so after a set amount of time, which in Luis's area is about 7 minutes, we allow 7 minutes of variability, the system has detected that there's a problem. And out of the thousands of rides that we might be monitoring at any moment, is going to detect a problem with this one and ask a guardian, that's what we call the team that powers the GoGo Guardian program, GoGo Guardians, to give Mohammed a call. So either Ivan or a colleague of Ivan's calls Mohammed back and discovers the situation. He doesn't necessarily need help finding Luis, but he's stuck in traffic and is falling behind. So we're going to call Luis's salon on that same phone number that she called us from and ask for Luis and let her know that Mohammed's falling a little bit behind. Success. We call the salon again when Mohammed is finally 2 minutes away. And so I'm kind of skipping steps here, but ride requested was the first part where we found Mohammed. Driver assigned and ride requested went together in that first step. The trip pickup is now where Mohammed fell into construction, and we told the client, in this case Luis, that he was going to be falling behind. So now when Mohammed gets there, we're monitoring the trip. Mohammed succeeds in picking her up, and then we're going to move into trip completed. In this example, I'm not sure if we do, but I think we cover it all on this slide. So when Mohammed is 2 minutes away, we call the salon and ask for Luis and let her know that Mohammed's going to be there soon and she should start heading outside. The pickup in this example, the pickup goes well and the trip home goes smoothly. After the trip, this is kind of the trip completed step. we call Louise with the cost of her ride and ask for her to rate the ride. She gives it a 5, presses 0 to speak to an operator, and schedule her next trip. So there was a lot of steps in this scenario where things could have gone wrong for either Luis or the driver. There was multiple drivers that were assigned that wouldn't have been able to fill Luis's needs. There was traffic on the road. Luis could have caused a panic. Also, what I didn't show in this example was where the salon was, and we're doing that for the sake of brevity, but in that trip pickup, the system would have detected if Mohammed was close but getting lost. So in this case, the salon was in a strip mall, and the entrance to the salon on Google Maps and where Mohammed would have gone would have been just the wrong building. So we would have intervened there and make sure all that goes smoothly. I'm doing this kind of for the sake of brevity, but there's a lot of problems that can go wrong, and we have solved those problems, and Luis is now going home. So that's a little bit more about how the experience feels for consumers. And then I also want to talk a little bit more about our partner program. Excuse me. So the main thing that GoGo does in partnership with organizations is allow them to subsidize specific types of requests for their clients. We also are able to give the GoGo Guardian program to partner organizations. That comes with the experience, but that would also be the same experience that any consumer would have using GoGo. So what we've done with now hundreds of organizations is set up kind of subsidy rules that they can create ride programs with for their clients. So I can talk a little bit about what that looks like. Our subsidy system is very robust. You can subsidize fixed dollar amounts. You can subsidize percentages. So you can say every trip that we subsidize is going to be $5 off, or every trip that we subsidize is going to be 20% off, or we're going to allow you a cap of $50 this month. You can use as many trips as you want, up to $50. If it goes over $50, then you can pay for it yourself. We can do those types of subsidies and more, I should say. Also coupled with kind of geography or time-based subsidies or destination-based subsidies. So we could say you can get this fixed dollar amount off. You can get this percentage off. You can get this $50 cap off for any trips that happen in this city, or in this city to these hospitals that are outside of the city, or in this city to these hospitals that are outside of the city, but only Monday through Friday between 8 a.m. and 5 p.m. Or for people that already have active transportation programs, you can say, you can use GoGo for, quote, after hours programs. Here's a subsidy that we're making available for anyone that needs a trip after 5, which is when our volunteers don't operate, whatever it might be. So you can mix and match these subsidies to make anything that you'd like. And then you can even have multiple subsidies that you're moving people through. So what we've seen some of our organizations do is they'll have kind of like 1 to 2 base subsidies, and then they might have like that exception group for people that live in further outskirts or that have consistent rides that they need taken. So you can mix and match is the major point here, and we're pretty flexible on how you want to do that. Here are some examples of municipalities that are using us and some of their subsidy amounts. I think I covered all of this. I think the one that I didn't cover is Fremont. Fremont, this was new for us, but they want the client to actually pay the first like $4 of the trip, and then they will cover the next 20, and then the client would pay for anything over that subsequent 20. So that's kind of an example of, you can get really creative with the subsidy types that you want to set up. A quick case study: Greater Portland Council of Governments, which is made up of several communities, each having its own budget. GoGo created one account into which each community, so if you have partners, other nonprofit partners or what have you, and the flow of funds is important, and how those funds are actually moved between people, you can kind of create a group fund rather than having other nonprofits give funds to you, and then you're managing those funds. GoGo can do so. And that's what we did for Portland. And then their subsidy was the first 4 rides every month to agreed upon locations were free. Um, for what you would have, the software that we would set up for you, your village experience would look similar to this. It would have your name and your members, but you have a dashboard. You're able to look up different users. You're able to see their ride history. You're able to see the costs of their ride broken down by what Lyft and Uber charged, what was GoGo's fee, what your subsidy was, what the customer ended up paying. You're able to see where they went. You're able to adjust the locations automatically that you want to be subsidized if you have a subsidy that is based on destinations. So it's pretty robust. You're also able and eligible to receive notifications if you would like. This is another kind of aspect of our consumer program that has been popular with the organizations that we partner with. But GoGo will, concurrent to a trip that's happening, the Guardian system will also send notifications at each stage of that trip to a loved one that's on file for that account. That could be a team member, that could be a family member for that loved one. We also can do email confirmations with receipts to people, and those loved ones can call in and kind of make modifications to someone's account. So this is kind of a demonstration of what that looks like. These text messages would be coming in sort of as these stages of the trip are happening. You also would get a dedicated support team. We offer a 24/7 contact center for all client complaints and concerns. And then our partners have their own sort of dedicated enterprise support that replies within 24 hours or same day. And then they're also able to create additional custom subsidies for beneficiaries with advanced needs. So everything I've discussed so far has been really about the mobility experience and the management experience that organizations would have. That same concept, though, of impairments that we develop as we age, impeding our ability to live independently in our home through a variety of ways. Like in the examples with Luis, it could just be there was a lot of things that happened, and it's not always easy for someone to stay on top of that. That same theme also creates problems within meals, groceries, and certainly medication pickups. And everyone here is probably more aware of what I mean than sometimes when I present to people that aren't as close to this audience of consumer. But there's complicated things that can happen. Even if these services make it easy and possible for someone to get something on demand, there are catches and twists and turns along each way. And so GoGo has extended the GoGo Guardian program to also serve meal requests from local restaurants that we assure are going to match someone's dietary preferences and restrictions, and then also groceries. And so these are both two types of pilots that we are currently trying to explore now. Work that our consumers have been doing for the last year, but that we think is a real opportunity for partner organizations to join us as well. I feel like I've gone about 25 minutes, and I wanted to have some time. I will quickly touch on the work that we were able to do for Alameda County in their COVID-19 response. We partnered with over 75 restaurants, and in fact, this is still ongoing, to get discounted meal kits from those restaurants assembled and delivered to over 700 people across this massive 739 square mile county. And so each person gets 3 meals a day, every day, Monday through Friday. And that's been done in partnership with local restaurants. So I don't know if there's anyone here that has considered engaging the restaurant community, but we can manage, in this case, some pretty severe logistical challenges. Not only are we coordinating with these restaurants across this massive geography, but we are tailoring each meal to the tastes and preferences of that person that we are responsible for serving. So it was a fun project to work on, and I'm really proud that we've been able to do such a good job with it and add it to our capabilities. I'm going to skip through the customer needs of Alameda County. They called us. Yes, so we're actually, these numbers are a little outdated, but I think we've delivered almost close to 200,000 meals now. I think we're at 150 meal kits designed around 24 different types of dietary restrictions. And that's not including like people that just have the off distaste of garlic or ginger. We've partnered with over 60 restaurants now across the county. I'm wrapping up here. I appreciate everyone's patience, but I just wanted to include this in the presentation. But our success to date is that since 2016, we have helped hundreds of thousands of older and disabled adults from around the United States manage their mobility, meals, and groceries, and more. We were very kind of confused when the first person wrote us a letter. That was not the way that we were used to communicating with potential customers, but they've continued to send them in, and so we put them up on our wall now. And then so that's sort of that's the summary of GoGo. We are excited to work with any villages that could see us filling a need with their volunteer organization. I know that wrangling volunteers can be tough, and if there are windows of hours that you make it available and you just can't do 24/7, we're happy to plug in wherever you'd like us. If COVID-19 is making some of your volunteers maybe feel uncomfortable, we can be a temporary plug-in for, until there's a vaccine or until whatever timeline you put together. We also are available nationally. And so we could be an opportunity for service members that might be traveling. I'm thinking of the East Coast folks that might have snowbirds that are going in Florida for winter and New York for summer. We can be available in those other places and kind of add on kind of our membership to your experience. So lots of ways, I think, to work together. And I'd be excited to explore opportunities with anyone. And that is my presentation. I think I'm clocking in under half an hour. So plenty of time for Q&A. I'm going to close out this, and then I will leave it up on my screen though if anyone has questions around different slides. So let me pull up, I'm done though, and I'm gonna pull up participants and chat.
We didn't have any chat per se, but I'd like to open it up if you just wanna, we have a group here of about 20 some odd. If anybody has any questions for Justin, I will put in the chat room his email if you all don't see it.
Harriet asked, what are the costs to the organization? And so GoGo charges a $10 per member per month membership fee. And that this is kind of to our consumers. And then on top of that, we do have a concierge fee. And so it might be $10 per member per month to be part of GoGo and gain access to these services, which kind of covers our cost of onboarding as well as account maintenance. And then as you are requesting services, there might be a $3 to $4 charge on average per trip that you're requesting. To the organization, it would be those same costs, and you can choose how you want to subsidize that. You can choose if you want to have the client pay a membership fee, you can cover a membership fee, you can cover a portion of the membership fee. And that's all kind of included in the subsidies that we make available.
I want to chirp in and tell my story with GoGo Grandparent. So Justin, I ran a village and left about 2 years ago, and we were one of the original villages to use GoGo Grandparent. So you've been in operation for about 4 years?
Going on 5. 5 will
okay.
January 4th.
Okay, so early on, we found a need, obviously before COVID, we found a need because we had a very robust transportation program. But the transportation, I see Dave Prescott's on the thing, so you can chirp on anytime you want, Dave. But we found that there was a need for times where our volunteers were not available. Like, that last minute, and I'm sure you all have had it, oh, I need a volunteer, they think they're sitting outside the room. I want to meet some girlfriends for lunch, and we just didn't have a volunteer to do that. So it was a way to connect our village members to that one spur of the moment, need. we found members were utilizing our volunteer services, transportation services 2, 3, and 4 times a week. And so we found this was a good happy medium, because we told our members, we have volunteers that are happy to help you, but we can't do every ride and every need. So it was a supplement, and it worked out really well. And we passed the cost on to our members. So we did the initial, the organizational fee, but the members had to pick up the cost, and then we would bill them every month. And it seemed to work for our village. So I just wanted to throw that out there.
Thank you so much.
Yeah. So when the question is, when you say per member, do you mean per village member, or is a village considered a member?
Per village member.
Village
So that would be anyone that you choose to enroll through your dashboard into GoGo.
So Tracy has a great question about, COVID being an issue and the standards, regulations throughout the country. How do you, structure the regulatory issue on health standards for our members, our clients, and what guidelines do you have in place?
Thank you for that question. So I can kind of quickly talk about, there's 2 pieces to that. There's what the underlying services have kind of mandated, and then what GoGo does on top of that. So for mobility, trips are sanitized in between, cars are sanitized in between trips. Clients are sitting in the back right seat, back passenger seat, and the windows are down. And this is sort of kind of maybe not entirely down, but there's airflow in the vehicle. And this is sort of what has been determined to be the safest way to do trip transports. It's during the pandemic. Of course, masks are mandated. And we do require that all of our clients are wearing a mask if they are taking a trip. The thing that GoGo does on top of this is, in that discussion with Mohammed, in the example of Luis, we are confirming with him during COVID now that he has a mask and that he has sanitized the vehicle since the last passenger pickup. And if he hasn't, we would cancel and re-request a trip and find a driver that has. For meals and groceries, it's contactless delivery. All these deliveries are being left at the door, a knock on the door. Once the driver leaves, GoGo is calling the client to let them know that the meal is outside. Excuse me. For my understanding, for groceries, the services are mandating that people are using gloves when they're in the store to pick up different items. And so it's trying to be done as safe as possible. And I think that especially for people that have underlying conditions that make them more vulnerable, it is a safer alternative than trying to go to a grocery store sort of on your own.
There's a couple other questions in the chat room.
I can run through them.
Okay, yeah.
So is the village billed, or can the member pay? Yes, to both. It's up to the village. So you can choose to reimburse the subsidy or the cost of the service, both our costs and then the underlying subcontractors' costs, or you can ask the member to do it. What Barbara was saying was that when she was running her village, they would make it an option available to members and then pass the cost through to the member. We've had some villages do that. We've had some villages offer a fixed fee reimbursement for trips. And so that's part of the subsidy options that we make available. You can mix and match as you'd like. So you can say, we want to offer this subsidy during these days at these times, or we don't. Or you can also offer a subsidy to these locations, or you don't have to. So it's up to you. To Pat, the $3 to $4 concierge fee. So for mobility, the actual fee is 27 cents a minute. And on average, that comes out to be between $3 and $4 per trip. That is on top of the cost of the trip fare. So the total cost of a trip in the US is around $15. That's our averages based on the trips that we've done. So it's not a percentage of the trip. It's actually the time that our team and our technology is monitoring the trip. It corresponds to the length of the trip corresponds to our costs. And so that's why we've structured it that way. To Pete, are the slides available? I'd be happy to send these to Barbara or to Travis and then allow them to distribute them any way that you'd like. Actually, why don't we fix that one typo with Muhammad. Muhammad is in the system monitor the trip as he approaches Luis. So now we can now that that's fixed, I can send that up. Is a credit card on file from Harriet? Is a credit card on file for each user that can be relatives, i.e. adult child? Oh, that's a really clever idea. So today, anyone can add a credit card to the account if they are authorized by the primary member, the primary consumer. So in Luis's case, Luis could authorize her child, and then he can add his credit card to the account. But the child would not be able to call in and add it until Luis sort of approved that. We do not have multiple credit cards. We don't have the ability now to sort of split the costs between credit cards. So that's a really good idea, and something that we might want to consider for the future. We do have the ability to split costs with a member organization. And so that, that's like the subsidy options that I talked about. But that's a really great idea about like, there would be adult children that might be interested in saying, I'm willing to be your subsidy, and I will give you $5 off trips to and from these destinations, or what I'm kind of kidding, but whatever that might be. So that's a great idea, something that we should add. Today, consumers can add their credit cards, or family members can add their credit cards, but we don't split between credit cards. And then from Academy for Lifelong Learning, can an individual member join? We just tell them about it, set them up to subscribe. Absolutely. Yeah, absolutely. And that's what we know that a lot of organizations have chosen to do. They can just keep our number handy, 855-GoGo USA. And in fact, I'll type that into the chat. Yes, our number is 1-855-464-6872. 155 GoGo USA. Someone privately messaged me if I'd be willing to present to their council on aging, and absolutely, we've done a ton of work with councils on agings, and would be happy to speak to anyone. I think that in this space there are so many people that are trying to help that you have to be willing to like get the whole team to the table and talk through like how subsidies can be set up. And so GoGo is very happy to do that. I would just ask anyone that is interested in that to email me, and then we can set up a time to do that down the road. But we've had a lot of success with, for example, if there's a nonprofit in an in an area that's heavily funded by their local area agency on aging, we will be happy to meet with, even multiple times in some cases, with that area agency on aging to set up like how the funding can be structured, and what that program might be. Oftentimes they might be a decision maker on how they would want to see it structured. And so we're happy to have those conversations.
Is there a particular, oh, sorry.
Go ahead. Sorry, go ahead.
Is there a particular region that you do more business than not? I mean, are you more West Coast based or center city, or just give me some of your demographics? That's
a great question. So our top 3 states are California, Florida, and Texas. And so, wow. And these are all places where it is kind of spread out. There's not a ton of public transportation, and they have good weather. And so it's places I think where people tend to retire, and they also sort of need to have a car to get around because it's not very walkable. And so that's where we've seen a ton of clients sign up. But we have clients now in over 15,000 cities around the US and in every state. And so one of the nice things about GoGo is that we have a lot of experience in different places. And we've definitely seen sort of flagship partners increase the just ambient awareness about GoGo in that area. And it kind of kickstart a flywheel to see us grow there. So that's happened, I would probably say, the most in Massachusetts and New Jersey, which has been really awesome to see. And so, but yeah, just our natural sort of consumer audience is mainly California based, Texas and Florida. Though there's a long tail on states that we operate in all the states. So
How do you become a flagship partner?
Just if you're the first partner in that particular area or that state, maybe that's a poor term, but that's just the way I think about it is, okay, great. This is like to give an example of New Jersey, they have a town council run nonprofit there called Rides for Seniors. I think it's something literal like that. So Rides for Seniors. And we were able to support that program with additional like media that we were able to make available for it. So we did flyers, and we participated in a press event, and we were able to make it kind of like a cool thing. And so that kind of grew naturally, both the program as well as the our membership in that area. So Academy for Lifelong Learning, do individual members participate in GoGo Guardian? Every trip, every request, be it a trip request, a meal request, a grocery request, has some version of the GoGo Guardian program monitoring it. That was the key and critical thing that GoGo realized as we've been around now for a few years, is that things go wrong. And in order for us to be the solution that people need us to be, a reliable solution that helps them continue to live independently in their home, we have to make sure that things don't go wrong. And so if that's a driver getting lost and going to the wrong entrance of a hospital, or if that's a restaurant forgetting the initial instruction and adding garlic to a dish, we have to make sure that those don't happen, because depending on the needs of the client, that could render that request useless, or worse, they could be stranded or left hungry. So everything is covered and monitored by the GoGo Guardian program, and that's part of the concierge fee. That's what that's going to cover. Tracy asked if there is already a transportation strain in our geographical area, i.e. Lyft and Uber are hit or not reliable currently. Does that affect the ability to implement GoGo in that area? So we are able to review the requests that have been made in any zip code or any area or any county in the United States and let you know what we think the service availability is like. In places where there isn't reliable service availability, and this actually ties back to the new sort of vertical that we're offering, depending on the partner that we are going into that market with, we have hired our own drivers that we call GoGo Medical to make them available for medical appointments. We've done this successfully in the Bay Area of California, and we're going to be doing it in upstate New York. And so we're getting more experience under our belts with it, and would be happy to work together with someone if they're in a county that doesn't have, like a more rural county that doesn't have, if there's a transportation strain in your area. So the first step would just be, if you're interested, we would be happy to share kind of what our experience has been like in your area. And then if it's dire or not so great, then we'd be happy to talk about partnering in such a way as to manage our GoGo medical fleet in that area. My pleasure. Great questions, just in general. Really great questions and comments by everybody.
Anybody have any additional questions? Come on, you guys are not shy. Anybody want to come off mute and ask a question directly instead of the chat room? Well, I think this has been great, Justin. We
Thank you.
we would like to invite you to become a network provider partner. We have a page, and you've been so great. It'll give you a link and hopefully drive a couple of the villages as we face yet another round of COVID, looking for alternative transportation. I do love the idea about the restaurants, especially when you have Uber Eats and Grubhub and everything else out there. But to cater it specifically to the individual, member person is that much more individualized. And so you had mentioned that for a village to do it, they would have to reach out to their local restaurants and food providers, correct?
Not necessarily. GoGo's happy to do that. I was just saying, if you already have experience working with local food providers, you might know a little bit more about what that's like. But if anyone was interested in setting that up, we are naturally going to be expanding that program over 2021. And so we'd be happy to consider any areas that we should look at first.
That's great.
Um,
I'm sorry.
I would love to learn more information about being a network partner, and I will send Travis this presentation for dissemination. But I just want to say again, thank you, Barbara, for making this opportunity happen. I know this was sort of bonus and add-on, and really appreciate it. So
no, we love it, and hopefully we'll have more opportunities to have some of our villages learn more about it. I think this has been, we'll post this, we'll send this out in our Village Buzz, which is the internal newsletter that we, Travis will be putting out in a couple weeks. Our regular newsletter's coming out this week. But we thank you for your time. It's been incredibly helpful, informational, and hopefully you all will jump on board. I thought it was very useful as an executive director back when I did it. A godsend, really, to help some of our members want to be that much more independent of the village. And I didn't even mention that everything came to the network, to the village. So it was just one credit card. So it was ease of access. The member didn't have to have any money on them. They just did their transportation, and then we billed them. And for adult children, that was really very, very important, that, because it was trackable. We knew what was going on, we could, say. So it was a great supplement to our transportation program.
thank you for saying that. I look forward to continuing the conversation with anyone that's interested. My email is justin@gogograndparent.com. And thank you all for taking the time.
Thank you.
I'm going to take off then.
Going.
Bye-bye for now.